What is the correct Subutex dosage? If you or someone you know is considering Subutex for opioid addiction treatment, you may be wondering about the correct dosage. Let's break it down in a straightforward way. Subutex is a medication that contains buprenorphine, which is used to help manage opioid addiction. It is part of a treatment approach called medication-assisted treatment, which combines medication with counseling and behavioral therapy. Buprenorphine is a partial opioid agonist. This means it activates opioid receptors in the brain but does so less intensely than full agonists like heroin or methadone. This unique property helps reduce withdrawal symptoms and cravings without producing the same euphoric high. Subutex comes in the form of a sublingual tablet, which means you place it under your tongue to dissolve. This method allows for quick absorption into the bloodstream. During the initial phase of treatment, the goal is to manage withdrawal symptoms and stabilize the individual. The initial recommended dose of Subutex typically ranges from 0.8 milligrams to 4 milligrams, taken once a day. This starting dose can be adjusted based on how the patient responds to the medication. The target dosage for most patients is around 16 milligrams per day. Research shows that doses above 20 milligrams do not provide additional benefits in managing withdrawal symptoms. Healthcare providers usually make dose adjustments in increments of 2 milligrams to 4 milligrams. These adjustments occur at intervals of 3 to 7 days. This careful monitoring helps ensure that the dosage meets the individual needs of the patient, allowing them to stay in treatment while minimizing withdrawal symptoms. In the context of addiction treatment, Subutex is particularly useful during the early stages. It helps manage acute withdrawal symptoms, making it easier for patients to transition into a more stable recovery phase. Once stabilized, some patients may switch to other forms of buprenorphine, such as Suboxone, which includes naloxone to discourage misuse. Subutex is often chosen for patients who cannot tolerate naloxone. However, Suboxone is generally preferred for long-term maintenance due to its formulation that helps prevent misuse. In summary, the correct dosage of Subutex is tailored to each patient's needs, with careful monitoring and adjustments to ensure effective management of opioid withdrawal symptoms while minimizing side effects. If you or someone you know is considering this treatment, it is essential to work closely with a healthcare provider to determine the best dosage for your situation.